This is my critical post about the last update of our German endometriosis guidelines 2025, which also do apply to Switzerland and Austria. You will find the link to those guidelines in my caption. First of all, I need to tell you that they are S2K guidelines. That means they are consensus-based, not evidence-based. Concerning the definition of endometriosis, they use two contradictive words. On page 86, they use endometrial and they also use endometrial-like. Obviously, they couldn't decide what endometriosis is. Is it endometrial or is it endometrial-like tissue? And I stick to the European endometriosis guidelines, ESHRE 2022, and it's written there on page 6 that endometriosis is endometrium-like tissue. I do agree. Coming back to our German endometriosis guidelines, they write on page 75 and following that endometriosis is a chronic inflammatory disease and it's described as benign, and that the cause of endometriosis is not known. This is true. Moreover, they are just talking about women and girls only in our guidelines, which I didn't like because every human being might suffer from endometriosis. I mean, our guidelines, they write some words concerning gender on page 23, but through the whole guidelines, they are just talking about women and girls only. So let's have a look. On page 75, they write that there must be a lot unreported cases and that they cannot say how much people suffer from endometriosis here. I do agree too. It took German doctors 15 years to diagnose my endometriosis. So, hang on. And the German endometriosis guidelines, so they also write that endometriosis would occur inside the uterus. But I don't think so. I stick to the European guidelines 2022, and it's written there on page 6 that endometriosis is a disease which occurs outside the uterus and is a full body disease, and its ramifications are systemic. I would like to add that, right? So I don't agree with the Germans. Endometriosis is not inside the uterus. It is a disease outside the uterus, right? And besides, the European guidelines also write on page 8 that, like I just mentioned before, that there are also people without uterus and without menstruation who suffer from endometriosis too. It's written on page 8, 2022 in the European ones. Coming to the endometriosis diagnosis in our German guidelines, there was a big change, and I don't think that this change was a good one, because now it's written on page 103 that one can diagnose endometriosis by imaging scans. So first of all, they mention the ultrasound, and second, they mention MRI. And the only exception where you still need biopsy to diagnose endometriosis would be the peritoneal endometriosis, according to our guidelines. But I don't agree, because you always need biopsy to diagnose endometriosis, because endometriosis can be missed on imaging completely, And also, like Dr. Jeff Arrington wrote me, one cannot always distinguish endometriosis from cancer on imaging. And it's also written in our German endometriosis guidelines that endometriosis can transform into cancer. They write it on page 201. So, concerning the therapy treatment of endometriosis, it's written that concerning hormones, it's a very long chapter. It's the chapter 4.1 from page 107 until 113. And I think the most important page here is page 108. And it's also very contradictory here. So at the beginning of this page 108, they write that hormones would reduce lesions and would stop the progression of endometriosis. But further down the same page, they write in a highlighted text, so those words are highlighted, that it's about symptom management. And my opinion is that taking hormones might be a try to reduce your symptoms, but endometriosis can grow nonetheless. It also happened to me. And it's written in ACOG's Practice Bulletin number 114, reaffirmed 2022, that there are no data to support use of medical treatment to prevent progression of the disease. I do agree. Moreover, concerning surgery, it's written in our German guidelines that it should be done minimal invasive. It's written on page 121. And they see ablation and excision as equal. It's mentioned concerning peritoneal endometriosis on page 120. Yeah, 120. I don't agree. So excision shall be really better than ablation, because by excision you can excise endometriosis by its root, right? And not just burn the surface. I mean, we know that there is no cure for endometriosis at the moment, but excision surgery shall be really better than ablation. And concerning pain management, our German guidelines write that they see medical treatment and surgery as equal, which is written on page 121. And the last chapter I would like to mention is research. It's written in our German guidelines that there is, too less research. We need more research. It's written on page 81 here in our guidelines. I do agree. And coming to the chapter 9, they wrote down questions for research which shall be done in the future. It's page 210 until 213. And guess what? They did not write down a single question concerning the disease itself. They forgot to write down questions concerning endometriosis itself, e.g. genetics. But, of course, they wrote down a lot of questions concerning research which shall be done in the future about hormones. They have a lot of questions concerning hormones. And I don't think this is fair, because we need also research into endometriosis itself, right? That's it. Of course, some of the organizations, or so to say a lot, have a COI. It's mentioned at the beginning, for sure. See you, bye-bye.